Eyewitness News presents Newsmakers, winner of the Pennsylvania Association of Broadcasting Award for Excellence in Public Affairs Programming, with your hosts, Jayne and Bugda and Andy Mehalshick.
Hello and welcome to Newsmakers. I'm Jayne and Bugda.
And I'm Andy Mehalshick. The COVID-19 proved very challenging for many people, especially those dealing with an addiction. But there's an extra level of concern for those folks.
Today, we are joined by a panel of experts to discuss the impact of COVID-19 on the road to recovery. We'll introduce you to our guests, and our discussion will begin when this edition of Newsmakers returns right after this. Welcome back to Newsmakers. I'm Jayne Ann Bugda along with Andy Mehalshick. And our topic of discussion today is the impact of COVID-19 on those who are dealing with a substance abuse or are on the road to recovery. And today, Andy and I are joined by Harlen, who is the Chief Executive Officer of the Wyoming Valley Drug and Alcohol, Stefanie Wolownik, who is the Prevention Supervisor, and Samantha Martin, who is a Clinical Supervisor. They're going to be joining us to discuss the impact the COVID-19 is having on drugs and alcohol, people who are in recovery and who are dealing with a substance abuse.
Hey guys, I'll throw this question out to get the program started. How has COVID-19, in what way has it made somebody coping with an addiction worse? Has it made that addiction worse? Has it made them go back to whatever they're addicted to? Has it inflamed that situation?
Yeah, hi Andy. I definitely think that it definitely has an impact in several ways. Number one, I think the way that we're treating people is a heck of a lot different than it was 3 months ago. At our agency, we continue to remain open. We're relentless with treatment. We're using a lot of telehealth. We also do have some people coming in. So we're hearing a lot how, addiction has affected these individuals during an epidemic or a pandemic, I should say, with COVID-19. So, you're seeing a lot of depression. You're seeing a lot of isolation. You're seeing a lot of, individuals just down because, they may have lost their job or, they're laid off right now at this point. So, we are seeing a lot of people, relapse, unfortunately, whether they were in long-term recovery or short-term recovery, we are seeing a lot of people relapse, unfortunately, due to those circumstances. So it's a very sad time for many reasons.
This is something that we're all dealing with for the first time, a pandemic where a lot of us had to stay home, isolation. But what are some of the challenges a person in recovery faced specifically during this time? Can you speak to that?
I think those struggling with substance use disorder and those who are in recovery, especially in the early stages, isolation is not something that is in the best interest of the client. They're encouraged to reach out, gain a sober support system. So that's been challenging during this time and having to self-isolate.
And, addiction is, sometimes they say people though it's an isolation for themselves to begin with. So this adds an extra layer of concern for people?
Absolutely. With AA meetings, having to go online, that face-to-face and that in-person engagement has been lost, unfortunately, in some circumstances. So that has definitely took a toll on a lot of the clients that we treat.
Let me ask you. You guys are the experts. You just mentioned, Samantha, the person-to-person contact. Are you guys learning? Are we learning more about the fact how crucial person-to-person, face-to-face human interaction is in dealing with addiction and counseling? Or Zoom is fine and Skype is fine and FaceTime, but does it have a bigger impact on those who really need that face-to-face human interaction, that close personal contact?
Absolutely. We offer a few different levels of care at our facility. A lot of clients have expressed their gratitude to us for being open through the pandemic and relying on the group support and not having that face-to-face and being able to connect in person. Telehealth, we're very fortunate that we were able to utilize that and keep everybody safe, but it definitely has had its struggles and has taken away some of what that in-person engagement brings to the table.
And how
Yeah,
have you? Go. I'm sorry. Go ahead, Jason.
I'm sorry, just to piggyback off what Samantha said, yeah, I couldn't agree, more with Samantha. Telehealth is fantastic, but I can tell you, we speak to our clients on a consistent basis, whether it's in the waiting room or, they're waiting to go to the bathroom, whatever it might be. The fact of the matter is, a lot of our clients are ready to come back face to face. They're saying, hey, we miss you guys as counselors. We missed, the group setting where, you have 8 to 10 people in a group and there's that interaction. So it's very, very tough.
Before COVID-19 was on anybody's radar, of course, and the opioid epidemic, opioid abuse is still out there, still a major problem. But did the COVID-19 situation make that even worse? We don't want to be like a Debbie Downer here, but it just seems that it's a domino effect because COVID-19 is out there now, and maybe those folks, did it make the opioid abuse worse? If you know.
Yeah, I mean, obviously we went from an epidemic to a pandemic. A lot of people forget that, this epidemic was here before this pandemic. So, it's kind of like two strikes very quickly, and especially with an unprecedented situation with COVID-19. So, there's a lot of agencies such as ours and a lot of other agencies that are doing fantastic work that had to make some major adjustments. So, yeah, it's a total 180, ensuring that our clients stay healthy, that our employees stay healthy. It's a very scary time for us as, essential workers as well. I could tell you personally, I struggle with it sometimes, but, coping skills, help me get through it just like the other employees. And, it's tough. It absolutely is tough.
And I think you hit a point there that is often lost, Jayne. In when you're talking about counseling, we had some psychiatrists on several weeks ago that you professionals are also feeling the impact of it. So how can you put your emotions on hold or feelings and help others? That's got to be a big challenge.
Yeah, that's a tough one. I could say as human beings, obviously we all have emotion. One thing we are good at is making sure that doesn't interfere with our day-to-day activities. Of course, employees have bad days. We all do as human beings, but our staff is very strong. There's a lot of things that I always stress to our staff is self-care. Self-care. That's the advice we give to our clients. I also give that advice to our employees as well too. It's very tough to leave your work at home. It's hard to do, but you do have to make time. Spend it with your family. Spend it with your kids. Do a hobby. Exercise. That stuff is so important. So I think self-care is so important as well too.
And you're in your office, like when you're trying to get the word out to people that you're still here, because a lot of people, even though there were different resources out there for them to call if they were in trouble, how did you get the word out? Did social media help you, or how did you reach out to people who were out there, or somebody who maybe needed help at that time? How did you get the word out to them?
I think we've done it in several ways. It was tough initially. I think everybody, as soon as the pandemic hit, everyone expected everything to be closed. Not a lot of people, knew that we were an essential business. I had to research that. When the governor put the order out about, hey, businesses have to close, I had to make sure our agency was on there and we were able to open. So, we utilize social media. We have a website. People called in. So we tried to stay as visible as possible, but it was very, very tough. So, social media is a big one. Our Facebook is very important to not only us as an agency, but the individuals that we serve as well, too.
And I do want to remind everybody, we do have your information linked up to ours on our website, pahomepage.com. I'm sorry, go ahead.
That's okay, Jana. Plus, as you know, Jayne, you've received a few emails from me. And that's what I've been busy doing. I've been sending out emails to area schools, agencies, workplaces, churches, anybody that I can think of with information on support and services and things like that, just to let them know that we're still here, we're still ready. If they have any questions, if they have any needs, we are certainly there for assistance.
And I know I received a lot of those, and we will have those informations because they're still available, they're still online, they're still going. For people that were just maybe, there's people that are in long-term recovery, but there were some people that maybe this was just starting for them. They're now at home, they're maybe can't cope, turning to maybe a substance. Even with alcohol, we saw that alcohol spiked. What do you say to someone now who may be watching, who said, I'm home every day. At 5 o'clock, I had to have a little something to take the edge off because now I'm home all day. I have kids home. I'm working from home. Do you think you're going to start seeing a new group of people who may be seeking help?
Yeah. Go ahead, Tam, please.
I was just going to say, I think that we are going to see an increase in referrals, and I don't know that we've really seen the worst of the pandemic just yet. And for those people, reach out. There's support. There's services that are here to help you. A lot of those with substance use disorders, it's oftentimes coupled with mental health issues as well. And turning to substances is an unhealthy coping mechanism for anybody. So just reach out, and there's a lot of support available.
What are you hearing from family members? Because as you know, and we've talked to you over the years from your agency, families are all a key part of this recovery process. But are they reaching out to you? What are they saying to you, if you can tell us, about what they're facing with their loved one at home or a friend that they're trying to help? Are they now facing special challenges helping those recover?
Well, Andy, I'll tell you what, yes. I have been taking phone calls, many more phone calls than normal, from family members who are now stuck in the house with the family member, and the family member is home because they're not going to work or whatever, they're not out and about. And they're stuck at home too because of the social distancing and safety precautions. And they're seeing how much their loved one is drinking or increase their drinking. And it's getting abusive verbally, emotionally, psychologically, and they just don't know what to do. So, I've been sending them some resources online, some telephone resources that they can talk to other people. Plus, I'm glad to say that as of this Monday, we will be having our family and friends support group starting up again. So they told me they are going to be coming to that. But yes, it is it's a family disease, Andy. So that, it doesn't just affect the person, the person with the substance use disorder. It affects the entire family. And the family needs support as well. And it's very difficult when you're all kind of huddled in together. I mean, we see the commercials and the funny kinds of things about families going through what I'm home, I'm working, and I'm taking care of my kid, and I'm also the teacher, Well, now imagine there's a substance use disorder in that household too.
And it's interesting, I'm sorry, Jayne, it's interesting also the dynamic, and we've all experienced it, being home. Part of the joy of being home with family is because you're away during the week working, or you wait for vacations or weekends coming, and now you're in a home pretty much 24/7. And as much as you love your family, let's face it, folks, it can be challenging out there. So if you have an addiction, a person dealing with addiction, that's going to be a whole dynamic that no one has seen before.
Yeah, space is very, very important for any human being. As much as we love our family, like you said, Andy, you need a break sometimes. And, one of the big obstacles that we're seeing right now an increase of is domestic violence. If you have, a household together and an individual is a victim of domestic violence, they are now stuck in that house with an individual who physically or verbally or sexually abuses them. So, that's a very unhealthy situation. So that's something that we have seen a major, major increase as far as calls and are concerned.
As counselors, have you ever experienced anything like this before?
I have not. I cannot say I have in my 18 years with the organization. Absolutely not.
Is this a learning moment for your agency? I mean, we've talked to people in various disciplines, and it's almost a given that all of us have learned something from this pandemic and the dynamic of it, including in the media, law enforcement, all over. It's really a game-changing moment for the world, really.
Yeah, it is. It's something that is just, It's fear of the unknown. It's the classical fear of the unknown. When is this going to end? Is an employee going to get sick? Is a client going to get sick? So, that's something that I don't think any of us have experienced before, at least in my lifetime. So, yeah, I think what we learned is, safety has to be first. We need to use caution. Even though that important thing is there, we need to treat individuals and get individuals help with a substance use disorder. We have to take care of ourselves first, because if we're sick, we can't help our clients that need our help desperately.
If someone's sitting at home now watching and they are experiencing this for the very first time and maybe think, maybe now I have a problem, what do you suggest that they do? What is your recommendation for them? Is there an online service they can go to? Is there a phone call they can make?
Yeah, it's very easy. I can tell you with our organization, all they simply need to do is give us a call at 570-820-8888. They could, contact us on Facebook through a message. Everything is 100% confidential. What essentially happens is, we'll have a conversation with that individual, whether it be through telehealth or in person. And do an evaluation. What we need to do is dissect that issue. We need to make a proper recommendation, just like as if somebody is going to the doctor and, they're being, tested, whether it be their blood or, for another type of disease. That evaluation is so important. That's the foundation. So there is help out there, and it's easily accessible.
And with social media, with the online services, how has that helped families? How has that made it a little bit more of a coping measure?
Well, for families and for those afflicted with substance use disorder, the online support services have been a godsend. Thank goodness we live in the time that we live for their availability. Support, fellowship is such an important part of the treatment plan, because I used to say, well, you're going in, instead of meeting people to say, hey, you want to go out and have a drink, you're meeting someone and, hey, you want to go out for a cup of coffee, and then you have that commonality with that struggle of substance use disorder. Well, the not having those fellowship meetings in person anymore has taken that away and has isolated even more. But there's a whole lot of people out there that never wanted to go to them in person in the first place, because it's intimidating. They can feel a little cliquish. There's some out there that they call the old timers that they feel, they don't want to barge in on them. So this has actually opened up a fellowship for people that shy away from the in-person meetings. And I've heard people say, I've kind of come alive in these online support groups. People with substance use disorder and also family members, it's true anonymity, because they're not seeing them necessarily. They don't have their video on, or maybe they're joining by a phone call instead. So they feel like that they're not alone, even though they might not be in person, but they have this whole support system right next to them, right alongside them. And again, it really, the community has really stepped up. And like I said, just thank God we live in the time that we live in with this technology.
Well, we are going to take a quick break, and when we come back, we're going to talk about online gambling and how that may be impacting some people during this time. You're watching Newsmakers. We are a proud recipient of 3 Pennsylvania Association of Broadcasting Awards for excellence in public affairs programming. Information on today's show and other Newsmakers can be found on pahomepage.com or under the Newsmakers link, and we'll be right back. Welcome back to Newsmakers. I'm Jayne Bugda along with Andy Mehalshick, and our topic today, we're discussing COVID-19 and its impact on substance abuse and the road to recovery. And we are joined by Jason Harlen, Stefanie Wolownik, and Samantha Martin, and they're all from Wyoming Valley Drug and Alcohol Services. And we want to talk now about something that maybe people may not have thought about, but online gambling. People who have a gambling addiction or who may be a little bored at home. Now you have the computer, you can gamble online. What kind of problems are you seeing with gambling addictions?
I think you said it correctly, Jayne, and I think it is the forgotten disorder. Our organization has several counselors on staff that are certified to do gambling treatment. And I got to tell you, the last 3 months, we've got a lot of phone calls as far as problems as gambling is concerned. As you mentioned earlier, when you talk about online gambling, you could essentially sit in your house, on your couch, in your pajamas, and click the mouse button and gamble. I mean, you could blow thousands of dollars in a short amount of time. So, one of the things we know about any kind of disorder is that, a lot of times people use it to mask pain or boredom is an enemy sometimes when it comes to a disorder. So, yeah, we're seeing a major spike as far as what we're seeing, at our agency as far as gambling disorder is concerned.
And Jason, because of the fact that people are with the stay-at-home orders, people now have more time at home. They might be working from home on the computer, and they have more accessibility to it. Has it increased the number of folks needing help with counseling with gambling addiction? Have you seen a growth in those numbers in your agency?
Yeah, Andy, that's a great question. I think the key word he used is accessibility. Again, we have seen, as I said earlier, we have definitely seen an increase in individuals who are requesting treatment for a gambling disorder. And it's a very, very tough disorder. Obviously, it affects money in a negative manner. Mental health is affected just like any other disorder in most cases. So yes, the numbers have definitely increased, at least within our organization.
And what's really fascinating about that in the crimes we've covered, Jayne, over the years, and me personally, is a lot of times we see theft, embezzlement, illegal distribution of funds. Almost always, again, anecdotally, it goes back to a gambling problem, either in person or online, and there's a connection to gambling. In many
definitely.
cases.
Yep, absolutely, Andy. That's 100% correct. We know with any type of, whether it be a substance use disorder or a gambling disorder, there's always negative consequences in a lot of cases, whether it be theft, whether it be health, whether it be underlying issues, problems. So yeah, definitely. It's going to be interesting to see what occurs once we get back to whatever the definition of normal is. And as Sam mentioned earlier, we're going to see what happens with referrals in the next month or two. So we do expect them to spike very heavily, unfortunately.
That's a good question. You put it perfectly in it. What is normal? And we hear the term new normal. Is there going to be such a thing? And what is that going to look like?
Another thing I want to ask you about is, a lot of people at home smoking and vaping. You think you'll see a lot of people maybe turning to say, hey, I need help because I've really overdid now that I'm home, away from, when you're in the office, you have to go outside maybe, but when you're in your own house, smoking is an addiction, vaping.
Yes. Well, and especially now, one of the primary reasons people smoke or vape is anxiety. I'm not quite sure you can get any more anxious than the state we're in right now with the pandemic. So people's smoking and vaping has more than likely increased, and sure, it's probably worrisome. But the other thing we have to remember too is that with COVID, smoking and vaping make you more susceptible to the illness, to the virus, because it affects the lungs. The virus affects the lungs. And when obviously we know all about smoking, but vaping too, people don't realize that when you vape, you're actually vaping small particles into your lungs. Heavy metals are particles of heavy metals are going into your lungs and causing little ruptures. And so just think about that going on your body and then going out and being exposed to COVID-19. So it's kind of like a double whammy. Not only are people increasing their use of tobacco products because of the anxiety, the social isolation, things like that, but they're also putting themselves at higher risk at catching the virus because of it.
And we have about 2 minutes left, but I do want to talk about the senior population, because a lot of people have been alone and away from family. Are you seeing substance abuse? And I mean, like with maybe with smoking, with maybe gambling in our senior population.
I could tell you as far as gambling, we have not got a lot of phone calls from seniors regarding gambling. There's been a few, but not as many as you would think. I'm sure that will change, in the next month or two. I'm confident it will. But as far as gambling is concerned, we really haven't seen a lot of that. Sam, I don't know if you want to comment as far as, the substance use disorder is concerned.
In terms of the elderly population, I know that our clients who we do see, I know that they've had difficulties, and it's been a struggle for them, maybe with an elderly parent and uncle, not being able to see them face to face, or I know there have been restrictions put into nursing homes, and that's been difficult for some of our clients to not have that support system, that to be able to see them, those that they relied heavily on, and for some of them that's been what's keeping them going, and the key to their sobriety. So I think maybe the fact that they haven't had as easy access to see them, that's been a challenge.
Well, we want to thank you for joining us today. Our time just flew, but we do have information on pahomepage.com under the Newsmakers link about today's show, about different places you can call if you do need help. For Jason, Harlen, Stefanie, Wolownik, and Samantha Martin, we want to thank you for joining us. For Andy Mehalshick and for everyone behind the scenes, I'm Jayne Bugda. Thank you for making Newsmakers part of your day, and we'll talk again next time.